Hello friends, once again we will start with these some x-rays I will show you, and after showing these x-rays we'll go with past paper questions. So here if you can see this x-ray is as you can see this developmental dysplasia of left hip with dislocation. So developmental dysplasia, as you can understand through the name, that it's a developmental disorder. So most commonly it starts from the birth to 1 year of the age, and it's very common in girls, and it's mostly involve the left of the hip. So you can see it has involved the left side of the hip, which is congenital developmental, as you can understand through the name. So it involved the from birth to 1 year of the age. So this x-ray you can see again, you have to keep in mind that this is the developmental dysplasia of left hip with the dislocation. There's a dislocation of the femoral head, and it's very common in the girls and mostly in the breech position. When the child deliver with a breech, then it have been seen in the breech deliveries. So here you can see this is a developmental dysplasia of the left hip with the dislocation. It's mostly detected early because in early neonatal examination it can be found, and then treated accordingly. If it is diagnosed in less than 6 months of the age, then they do this procedure with pelvic harness. This is a soft breast used to treat the developmental dysplasia of the hip in infants and sometimes of for femur fractures. So if it is less than 6 months, then pelvic harness. If it is between the 6 to 18 months, then close reduction with spica would be done. If it is more than 18 months, then osteotomy or open reduction. So this is the case of the developmental dysplasia of left hip with dislocation, and it's early detected in early is from the birth to 1 year of the age, and it's very common in the girls. This is the second X-ray. This is the X-ray of slipped femoral epiphysis. You can understand through the name of, as it is name is slipped femoral epiphysis. So this is also known as slipped capital femoral epiphysis. It's a hip disorder primarily affecting the adolescent, where the head of the femur slips off the neck of the femur at the growth plate. So this disorder, which is common in from the age of 10 to 16 years. For the diagnosis, you have to keep in mind that this is common in the above the age of 10 years, so between 10 to 16 years of the age, and it's very common in boys and obese. So from the age of 10 to 16, it's very common in boys and obese children. So in this case, what happens? The head of the femur slips off the neck of the femur at the growth plate. So head of the femur slip at the neck from the neck of the femur at the growth plate, which is called slipped femoral epiphysis. Child will present with the hip or knee pain, and limping is very common symptom. So it is commonly occurs at the age of 10 to 16 years in boys, obese, and limping will be the common symptoms in this case. So this is the case of slipped femoral epiphysis. This is third and last X-ray. Then we'll go for the MCQ. This you can see, this is the Perth disease. This is very common at the age of 4 to 8 years. And this also very common in boys. So 4 to 8 years of the age, common in boys, usually unilateral. Here what happens, avascular of the necrosis of the femoral head. So in this disorder, blood supply to the hip joint, femoral head, is temporarily disrupted. That is also called leg calf Perth disease, or this is also known as leg calf Perth disease. These are the three people who discovered this disorder, and they put their own name, leg calf Perth disease of left hip, as is shown in the X-ray. So it's common in the from 4 to 8 years of the age, very common in boys more than the girls. Usually unilateral with avascular necrosis of the femur head. So temporarily disruption of the blood supply of the femoral head, and that's called Perth disease or leg calf Perth disease of left hip, as shown in the X-ray. Now we will go to the MCQ. I'll show you the MCQ which came in the past papers. So then we will discuss about the correct answer of that question. So now I'm going to show you that question. So this question is 2.150. This is from the Australian Medical Council handbook, and this came in the exam, which is also, we can say that this is past paper question. Multiple times I have seen in the previous papers. A 12-year-old boy whose weight and height are on the 90th percentile complains of pain in the right hip for several days, and his mother has noticed that he is limping. Which one of the following is the most likely diagnosis? Those of you who have watched the previous this video from the start, definitely they will give the correct answer. So we are going through this question again. This 12 years age, 12 years old boy whose weight and height are 90th percentile, it means he is obese, complains of pain in the right hip for several days, and his mother has noticed that he is limping. So these all are you can see the 12-year age. Now if you memorize the previous things, definitely you will give the correct answer out of these options. So 12 years old boy, weight which is 90th percentile, complain of pain in the right hip for several days, and his mother has a notice limping. Which one of the following is the most likely diagnosis? I know you all knows about this, which one will be the correct answer. So options they have given: A is slipped capital femoral epiphysis. Option B is Perth disease, which is also known as osteochondritis of femoral head. Option C is septic arthritis. Option D is non-specific synovitis. Option E is the osteogenic sarcoma. So first we will exclude the remaining options which are not correct. As we can see in option C, which is septic arthritis, why we can say that this is a septic arthritis? Septic arthritis will present with the fever. As you can see, there's a no history of fever. Systemic symptoms will be there. Patient will have a acute presentation, and child will be very sick, as they have mentioned that right hip pain for several days, as mother has noticed the limping. So these symptoms are not there, fever is not there. So, and also the duration of the symptoms is very long, as several days, we don't know that how many days. So but septic arthritis will present with the, that presentation will be acute, so we will rule out the septic arthritis. Another option D, which is non-specific synovitis, mostly it present after the post-viral, sometime after the viral infection, the joint pain will be there. So non-specific synovitis also we will exclude. Osteogenic sarcoma mostly present with the lump, as here there is a no lump in the history. So these three C, D, E, all these we will exclude. Now we are thinking about the A and B. So as I showed you in X-ray images, that Perth disease, which is common in 4 to 8 year of the age. As you can see that this age is 12 years. So as we discussed that slipped capital femoral epiphysis, which is common age group, is 10 to 16. So this scenario, this answer fit in that question. So this occurs in the 10 to 16 years age, and also as we read about the this, that is common in boys, and also obesity. So all these factors with limping. So the correct answer is, answer is slipped capital femoral epiphysis. Correct answer is slipped capital femoral epiphysis. This question commonly you will see in the exam, and I have seen in the previous papers multiple times. So these all slipped capital femoral epiphysis, Perth disease, developmental dysplasia of the hip, these all three topics, you have to go through all these, you have to clear your concept and try to understand. These questions will be in the exam. So I hope you have your concept is clear now. So I would give you more question in upcoming videos. Thank you very much.